All right. So again, to those who's joining us, thank you for doing this. So this is again part of the series of Bean Bag Banter. So we are AAA Physical Therapy. It stands for across all ages, and we're on the bean bag, obviously, as you can see. But we're also on high-low. It's a bed that goes up and down. And the reason why we're settled it here is because what Olive, our awesome physical therapist, is going to discuss is about fall prevention, and especially for the young at heart. Okay, I don't want to call them seniors or elderly. I don't want to call them that. I'm going to call them young at heart. All right. So Olive, our physical therapist. So, what is the role of physical therapy for activity and wellness and for fall prevention for the young at heart?
Okay, so that's an interesting question actually. But well, so technically, we have to define actually what elderly means.
Okay.
So the listeners could, of course, differentiate that.
Sure.
Well,
What is elderly for you?
Well,
While you're staring at me.
well, technically, elderly are people who are age 65 years or older.
65 or older. Okay, sounds good.
Mm-hmm. So back to your question, maybe, the role of physical therapists in the prevention and wellness is actually there's really a big role.
Okay.
So the American Physical Therapy Association actually listed some of the responsibilities of PTs on that one.
Okay.
And one of the social responsibility of a physical therapist would be an advocate for prevention and wellness. So, as what they say, an ounce of prevention is better than a cure.
Versus a pound of cure.
Right.
Yes. Yep.
Yeah, you said that
Okay.
right. So, in terms of, and I believe that the most or the simplest intervention that us physical therapists could give to our patients, most especially with elderly patients, would be education.
Mm-hmm.
So, of course, with the elderly, they have like a lot of comorbidities already. Like they are the ones who have like a lot of conditions or diseases and all of that. So sometimes, in addition to that, they're taking in some medications,
Mm-hmm.
and with that already, they have certain what do you call that, side effects.
Side effect or
And
impact. Yes.
most of it would be dizziness, most of it would be, of course, nausea and all of that. That could put them at a high risk of falling. So with that one, that's why when I do my initial evaluation most of the time,
Mhm.
I usually have to clear out what medications they are taking.
Okay.
So that we have, we just know how to, of course, how to say that? We just know how to tailor fit a good home exercise, or not just a home exercise program for them, but of course an intervention to decrease the risk of falling.
To the things that we're doing here.
Yeah.
All right.
Mhm.
So again, and obviously, I know our focus is the elderly or young at heart here, or if we just want to operational define it, anybody over than 65 years old, if they're taking medication, then as you mentioned it, and it's possible as we age, there are other comorbidity factors that we have to pay attention to. But just, excuse me, but just going back to that, regardless of age, if you're taking a lot of medication to begin with, there are a lot of other factors that we have to go ahead and consider. And again, if there's fall risk, again, that's why our philosophy here is to provide the best personalized physical therapy possible. And if we know more of their history, that should help out of how we have a game plan in helping them out with other aspects that they're dealing with. Right?
Right.
Okay. Okay, sounds good. All right, and then you also mentioned about the roles of physical therapists, and that's why we're doing these Bean Bag Banter to provide these educational series so that our audience would be able to know more about how to take care of themselves and not have a lot of other issues that could come about because we're not taking care of ourselves. And again, and APTA, as she mentioned, that's our role. So, all right, great, thank you. So, can you go ahead and identify, again, we're in fall season right now. What are some common things that we just have to pay attention to so that we don't fall? Again, I know this is targeted to people over 65 years old, but generally speaking for all of us, so that we don't hurt ourselves and not let gravity get the better of us. So what can you say?
Well, it should always start at home.
Start at home, okay.
Actually, so yeah, that's what I've said a while ago, that the most or the least, the simplest way for a physical therapist to be an advocate for prevention and wellness would be to educate our patients. So, to supplement that one, I would say that we should always tell our patients that fall prevention starts at home. So one of the things that they should be able to, of course, make sure their home should be clutter-free. Because of course, if you have like a lot of clutter in there, that would put you at a high risk of falling, because you know you just walk
have a
around.
lot of stuff.
Yeah, and then of course a good lighting in place, even at night.
Even at night, okay.
Should be is important that it's there, because of course in elderly, they already have those comorbidities. Sometimes they just wake up in the night with they need to pee or something.
They have to go to the bathroom,
Right.
okay.
So they should have always a good lighting in place.
Okay.
And in addition to that, well, I think one of the most important things would be improving or maintaining, at least maintaining their muscle strength. Because a good or the basic requirement of a good balance is always a good strength on not just on your lower extremities, but actually the whole body. So with physical therapy, we usually teach them on how to improve most of what is lacking in them. So in terms of that one, we do initial evaluation as what I've told you a while ago, to tailor fit, which is really lacking. So in terms of like a lot of them would fall into like most would be generalized body weakness. So on that one, they also present with decreased endurance already. So we usually improve that endurance first, and then go to the strengthening, their proprioception, and of course going to the balance exercises to improve more of that.
For us non-clinical people, what do you mean by proprioception?
Well, it's actually your perception of the direct like
Of the surroundings?
where a certain body part is.
Oh, okay. So, kinesthetic sense?
Something like
So,
that.
okay, similar to that. So that where's my body, where's my leg, and how is its position in relation to my physical surrounding. Okay, thank you. All right. So, yeah, so given that, make sure if you're taking care of somebody at home who's young at heart, or whoever for that matter, make sure that there's proper lighting.
Proper lighting?
And it's really funny because when she said about clutter-free house, she stared at me again. I know we're doing a podcast here as well, so you're not seeing what it is. So yes, make it as clutter-free. Simple things like wires, I can imagine.
Yeah.
Chairs or small boxes around. Make sure that the pathway that you're going to is as clear as possible. Especially when, like what you mentioned, when you're half awake and you have to go to the restroom to take care of business. You want things to make sure that you see your path and it's clear, and you can just go directly and take care of business there.
Right.
All right.
Yeah. And one more thing about that one.
Go ahead.
Of course, with the mats. Mats in the bathroom and everything, make sure that it's always like
Flat on the ground.
flat on the ground with, what do you call that, the skid.
The skid-free, the skid, the thing that doesn't slide.
Right. Always
It's a
have,
ski-
that would always be important.
Like rubberized, and make sure that it's flat there and there's no fold or anything like that. Yeah, thank you for that. So any rug or carpet or anything for that matter, make sure it's flat on the ground and you step over it as much as possible and just make things be clear. All right, great. Thank you. All right. So you mentioned about strength and balance, strength and endurance, and again, you can imagine it's not only for anybody over than 65 years old, that's all of us. So, excuse me, what are your suggestions for them to, what are basic things that they can do on their own to maintain a certain level of endurance and to gain some level of strength?
Well, I believe that the most or the simplest form of exercise is always walking.
Walking.
Uh-huh.
Did you guys hear that? Walk.
Right.
Okay.
Even just for 15 minutes a day or something like that. Or if you really have some decreased endurance, you can always start with just walking inside the house. Just like a few rounds, and then when you start to gain some of your cardiac endurance already, then you can start walking outside.
Outside, yes.
It will always be a good view to walk outside. Plus, walking outside has some certain challenges, like there's like uneven and even surfaces, but of course they have to be careful with that since falling. That's why they really have to improve more first, their ability to be comfortable walking inside. With walking, you increase your endurance already. You improve your strength on the muscles on your body, and of course, with even and uneven surfaces that you're trying to negotiate outside, then you're improving the balance. But of course, always make sure that if you're not really sure that you're not confident with the balance, always make sure that someone is always there to accompany you.
All right, great. And here in Colombia, we are so spoiled that we have all of these walk pathways outside, and we understand it's getting colder soon, so, and if there's snow around, just be careful if it's icy or anything to that effect. But yes, that's a good way. Walk around your home, and you can go ahead and check if it's clutter-free, and that it's safe, and all the rugs are safe, and then possibly gaining strength during this winter time is that you put a lot more jacket around you, so that's extra weight in there. So just walk around a little bit. Just challenge yourself, and again, just make sure you're safe. Make sure you have your phone always with you, just to make sure that you are good, just in case of for any type of emergency. And how about vision? Do you think that's something that they should be
Yeah.
checking with their optometrist?
Right. Good thing that you mentioned that one. I actually forgot about that one. Of course, vision is really important.
So it's possible that you're fully lighted, but if you're
Yeah.
wearing eyeglasses and it's not the right fit, so make sure you work with your optometrist. And that's what it is. We cannot, us as physical therapists and me being a personal trainer, we don't do everything, so make sure you have that thing checked.
Right.
And then we have another physical therapist, Nina. She's a vestibular specialist, so that's something that to be considered as well if you have some level of dizziness, right?
Yeah. Of course, muscle strength or other things are not just the requirement for a good balance, but of course, yeah, your vision, your vestibular, ocular reflexes, and something like that. And yeah, so make sure that they have to see their optometrist
Optometrists work with their optometrist.
annually, because it's the recommended time for them to check with them.
Okay. All right. Sounds good. All right. So to the viewers, to the listeners, to the podcast, again, we thank you for joining us here. If you have any other questions, just email us or call us here at 443-979-7171. Even if you're not around here, feel free to communicate with us if there's anything else you want us to go ahead and discuss regarding your physical therapy questions, regarding your health and wellness questions. Because again, our physical therapists are not here just to deal with fall or fall prevention. We're here to transform people's lives as much as we can, because we're here to go ahead and really promote health and wellness, whether above 65 or what have you. So, Olive, is there anything else you want to add or share regarding fall prevention for anybody over 65? Is there anything else that you want to highlight or just share out there?
Well, always see. If you have any problems with balance, it's always wise to see of course, and anyone that could help you, like your physical therapist, so that they could help you with improving that and decreasing the risk of it.
And I think there's a myth there that if you are if you think you're losing it, quote unquote, it's not a matter of toughing things up, right? Work with your specialist, work with a professional, because if you fall, you're going to have a hip fracture,
Yeah.
hip injury,
Right. Yeah, that's the.
or if you brace yourself with your arms, now you're going to have arm issues, shoulder issues. So again, just like what she said, that's why we have the saying, because there's truth in it. An ounce of prevention is better than a pound of cure. All right? Okay? So again, if you guys have questions, feel free to touch base with us. And we really appreciate Olive. All right? Thank you.
Thank
All right.
you.
So please watch out for all these other videos that we'll be producing here. And we appreciate you joining us here with AA Physical Therapy's Bean Bag Banter. Thank you, everyone.